Welcome everyone to Trillium Health Partners. I am so pleased to be here today. I am your President and CEO, Karli Farrow, and today's a very, very special day at Trillium Health Partners and also for our entire country. It is not very often that we get to host our federal partners here today, so we are very, very excited to give them a warm THP welcome when they do. Let's do that now. Not bad for a Monday morning, not bad for a Monday morning. I want to extend a special welcome to Minister Holland, who is here, of course, our Minister of Health federally. We also have MP Khalid, MP Sidhu, and MP Sahota here from this region. Thank you so much for being with us today. We also have members of the broader Health Canada team, and of course, we have Dr. Leigh Chapman, who needs no introduction here at THP. For those of you who are new to THP, Dr. Leigh Chapman is Canada's chief nurse and also an alumni of this very hospital. Leigh, we're so happy to welcome you back and thank you for your continued support and leadership. As one of Canada's largest hospital systems, we know we are only as strong as our people, and that nursing is the cornerstone of our healthcare system, embodying skill, expertise, compassion, dedication to patient care, body, mind, and spirit, as we say here at Trillium Health Partners. Today, we're gathering to celebrate and strengthen supports for the nursing profession, recognizing their invaluable contribution to the communities they serve right across the country. I am not going to speak long. We have many excellent speakers and exciting things to share, but thanks everyone for coming and being here with us today. And with that, I am going to ask our amazing MP Khalid to the stage to get the show on the road. Thank you.
Wowza, good morning everyone. I was just saying to my colleagues that it's very rare for us to see so many people out for announcements. So I think it really speaks volumes to how important it is that we are all here today. So before we begin, I'd like to acknowledge that the land that we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit First Nations, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis. We also acknowledge that Toronto and Mississauga is covered by Treaty 13 with the Mississaugas of the Credit. My name is Iqra Khalid. I am your Member of Parliament here in Mississauga, Erin Mills. More than happy to serve so many of you in our community, so welcome. I'd also like to extend a very warm welcome to the Honourable Mark Holland, Canada's Minister of Health, Dr. Leigh Chapman, Canada's Chief Nursing Officer, my colleagues Ruby Sahota, who is our Chief Whip, and my colleague MP Sonia Sidhu, who is a champion on diabetes work across the world. Thank you for being here. We are very pleased to be with you for a very important announcement, which will provide critical support for the working lives of the amazing nursing professionals all across Canada. Today's announcement will also help employers improve nursing working conditions and increase support for nurses seeking to join the workforce. I'd also like to extend a big thanks to the Credit Valley Hospital and the Trillium Health Partners for hosting us today. This organization has contributed immensely to your important work of keeping people in Canada healthy and safe. And I have to say, 6 of my nieces and nephews were born right here in this hospital. When my dad had a heart attack 15 years ago, it was this hospital and this community that took care of him and our family during this difficult time. You are my residents, we live together, we work together, we take care of each other, and I cannot begin to stress how important the work is that you do and how we should be continuing to partner with each other to ensure that all of you are strong. So please note that there will be an opportunity for media to ask questions following the announcement. But right now, it is my honor to introduce to you today the Honorable Mark Holland, our Minister of Health. Minister Holland was first elected as the Member of Parliament for Ajax in 2004. It's a long time ago, right, Mark? Yeah. As a Member of Parliament, Minister Holland has served as Leader of the Government in the House of Commons, as Chief Government Whip, as Parliamentary Secretary to the Minister of Public Safety and Emergency Preparedness. He has been a staunch advocate for marriage equality rights and played a key role in helping to reform Canada's animal cruelty laws. In both public and private roles, Minister Holland has backed health-related initiatives. He has served as Executive Director of the Heart and Stroke Foundation for Canada's Ontario Mission, as well as its National Director for Children and Youth. Ladies and gentlemen, please join me in welcoming Minister Holland. Please.
Merci beaucoup, Iqra. C'est un grand plaisir d'être ici aujourd'hui avec Ruby et Sonia aussi, et pour un jour vraiment historique. Historique pour, oui, l'infirmière, les médecins, pour notre système de santé, mais généralement pour Canada aussi. It is such a pleasure to be here at the Credit Valley Hospital site of the Trillium Health Partners, and to get an opportunity to talk about with some of the extraordinary leaders and nurses that are here doing just extraordinary things. I'm going to start by thanking Dr. Leigh Chapman, who, Leigh, everywhere I go, people talk about the incredible work that you do. We are so lucky to have you as Canada's first Chief Nursing Officer. You really are defining that role. We can never have you leave. So hopefully you're enjoying it because you understand fundamentally what's needed, what's needed for nursing and what's needed in our health system. And look, folks, I don't have to tell you, I look around and I see so many faces who are directly involved in delivering health care here in Mississauga, just how difficult it was. You know, when you go back to the beginning of the pandemic, not so many years ago, it was such a deep trauma, I think, for our whole country, but it was particularly so for those that were in healthcare. And I was having an opportunity to talk to Terri just about how things were 18 months ago, just how difficult it was. The weight of the world had been on nurses, had been on doctors, on personal support workers, and that weight was nearly crushing. And so it was a time of real difficulty 18 months ago. And we knew we have to step in. So I want to tell you that you can feel that change coming, but I want to talk about it in some very explicit ways. I'll start with the investments that we're making across the country in healthcare. $200 billion over the next 10 years. And I have been going around in every province and territory. We were here a few weeks ago in Toronto for the Ontario announcement, talking about not only how that money is going to go in, not only how it's incremental to provincial plans already there, but having key indicators so that you can see that progress built into the system, so that there's accountability to the money that's been put in. And so too, as we're making those investments in health workforce, in helping support nursing, in helping make sure that we, and I'll come to nursing in just a second, we also got to be upstream. You know, Terri was talking about not thinking enough in our system about what is upstream, and I couldn't agree more. That's why on Thursday I was so proud to be with my colleagues to make an announcement on pharmacare, making sure that every Canadian everywhere in the country has access without cost to their diabetes drugs that they need and for the devices and apparatus for their health. It's not only a fundamental issue of social justice, it is going to make a massive difference for preventative health. For contraceptives. Contraceptives, again, you know, you look at BC, which started with the universal contraceptive plan, that actually has now been saving them more money than they spend. And this is the thing, when we can get ahead of the crisis and we can move down the stream, then these investments can not only improve health outcomes, but can reduce costs. That's what dental care is about, making sure that 9 million Canadians who don't have dental care will have dental care. But today we're talking about nursing, in particular around retention. You know, we're doing extraordinary things to recognize foreign credentials, to help bring folks to this country to help. But you can't fix a problem unless you're holding the people you have. And it was said in our discussion earlier how important it is to make sure that that work is joyful. And it hasn't felt joyful for a little while. The amount that's being placed on people's shoulders is incredibly difficult. So we need to change that paradigm in two ways. And part of it is in the nursing retention toolkit that Dr. Chapman has led in consultation with folks across the country to make sure there's a plan, tools, and resources for a coordinated approach where you don't have to reinvent the wheel every time, to know how we can do everything we can to hold on to our best talent. And the second thing is to make sure in the investments we're making with a health workforce, with a center of excellence, that we're projecting the health needs in the future. So that if you're a young nurse coming into the profession today, you don't face that cycle. Listening to nurses who've been around for 20 and 30 years talking about the ebbs and flows from good times into crisis, back to good times, we can't do that anymore. It's way too damaging. No, we can't predict the next pandemic. We can't predict the next health crisis, but we can ensure the flexibility exists within our system so that it's never in a state of crisis again. Because those who go into health, particularly nurses, go into the joy of service. And the last thing you need to be worrying about when you're worrying about a patient is how are you going to make it through the day? How are you going to be given enough hours to spend with your family? How are you going to be given enough room to continue to have the compassion to be able to care for others if the system isn't caring for you? And so I want to speak, and I'm going to turn it over to Leigh here to talk the specifics of the nursing retention toolkit that we're announcing today. But I want to say that the spirit that I saw in Charlottetown, when all health ministers got together from across the country and asked the question that healthcare workers asked in the darkest days of the pandemic, how do we pull in one direction? How do we set aside our partisan differences? How do we set aside our egos and the barriers and ask one question, how do we make it better? How do we take one of the best health systems in the world and make it the best health system in the world, one that is worthy of the incredible nurses and doctors and personal support workers who work every single day in our system? And I can say that I'm dedicated with every force of my energy and being to that question of making things better, of taking our turn. You carried us through the pandemic. Now it's our job to make sure that we make things better so that no such crisis ever exists in our health system again, to the extent to which we leaned on your shoulders to get us through those dark days. I want to thank you incredibly for the work that you've done to get us here. I want to say that we're going to work, Ruby, Iqra, Sonia, and I, with every part of our being to make sure that we have that health system we're speaking about. Thank you for the opportunity to be here today, and I'll turn it back to Iqra.
So we all noticed that you hopped on and hopped off the stage there. These don't really allow for that to happen, but we have lots of good people to take care of us if we break our ankles here today, I'm sure. Thank you so very much, Minister Holland, for being here. Really, really appreciate it. Next, I really want to hear from Dr. Leigh Chapman, who has been an alumnus here and has done phenomenal work across the country. Thank you so very much. Looking forward to continuing to work with you. Let's hear this wonderful announcement.
Thank you so much, and good morning, everyone. I'm Leigh Chapman. I'm Canada's Chief Nursing Officer, and it is an honor to be with you here today for this important announcement. Je suis Leigh Chapman, infirmière en chef du Canada, et je suis très heureux d'être parmi vous aujourd'hui pour cette annonce importante. As many of you know, I worked at Credit Valley here in the emergency department as a unit clerk now almost 30 years ago, both prior to and during my nursing education. And as I'm sure many of you can attest, the emergency department is an excellent training ground and place where many of us learn resilience, quick thinking, and emotional fortitude that our field demands. Now, with over 20 years of experience as a nurse, I continue to be inspired every day by nurses across Canada. Canada is so fortunate to have nurses with such great knowledge, expertise, and professionalism in the health system. Despite the complex and ever-changing healthcare environment, nurses respond with humanity, composure, and competence. Yet it is clear that our profession needs support now more than ever. Mais il est également évident que notre profession a plus que jamais besoin de soutien. Since my appointment as Canada's Chief Nursing Officer, I've dedicated myself to engaging with the nursing community in various settings across our great nation. I've been pleased to meet with nurses in every province and territory in Canada since my appointment in August 2022. And it's through these interactions that a pressing issue has emerged: nursing retention. Although there are efforts underway to support recruitment of new nurses, we need to shift our gaze to how we are valuing nurses who are already part of the profession and to what we are doing to keep them. To address this challenge, I'm proud to be here today with Minister Holland to present the Nursing Retention Toolkit. I am very proud of this work. This collective endeavor is a testament to our commitment to improving nursing retention, to addressing issues that many of you face in your workplace every single day, including an unreasonably high workload, moral distress, and violence, to name a few. As Minister Holland said, we did this together. Starting with the Nursing Retention Forum in June of 2023, we gathered many diverse perspectives, including point-of-care nurses, union representatives, employers, students, educators, professional associations, and regulators, to hear about what is needed and to learn about the effective strategies that some of you have already implemented in your workplaces. I do believe that the toolkit, born from evidence-based practices and lived experiences of Canadian nurses, is a great starting point for positive change in nurses' working lives. It provides a comprehensive framework for collaboration in supporting the dedicated professionals who care for us and our loved ones. Now, we need to spread the word. Maintenant, il faut faire passer le message. Encouraging employers and health authorities to engage nurses in implementing the toolkit is crucial. We want to share this widely and also encourage continued collaboration and connection with those organizations that are highlighted as best practice resources. We want to build a network where we can scale up the successful initiatives that have been shown to improve nursing retention. I know that when we work together, we can create solutions that will drive meaningful change in the healthcare system. Je sais, lorsque nous travaillons ensemble, nous pouvons créer des solutions qui conduiront à des changements importants dans le système de soins de santé. Let us continue to work hand in hand for the betterment of our healthcare system and the incredible professionals within it. Thank you for your attention here today and for your support in sharing and implementing the toolkit across Canada. Nous vous remercions de votre attention aujourd'hui et de votre soutien dans la diffusion et la mise en œuvre de la boîte à outils dans tout le Canada. Merci beaucoup.
Merci beaucoup, Dr. Chapman. Je vous remercie pour votre engagement et votre travail. It's really an honor to be here with you and to have you represent Canada and nurses across Canada. Next, I would like to invite up Terri Irwin, who is our Executive Vice President of Patient Care Services and Chief Nursing Executive for Trillium Health Partners. Let's hear it.
Wow, gang, we've made it. Doesn't it feel like we made it? I'm so happy to see all of you, but I missed the Chuck's memo. Yeah, missed the sneaker memo, and I was having a bit of anxiety sitting there thinking, do I have to speak French? You will not hear French. So as Iqra mentioned, my name is Terri Irwin. I'm the Executive Vice President of Patient Care Services and your very proud Chief Nursing Executive here at Trillium Health Partners. I am speaking here today from a place of immense gratitude for the opportunity to address such a vital topic alongside my dear colleague and friend, Dr. Leigh Chapman, Chief Officer of Canada. Leigh, thank you for your dedication to nursing. Your ongoing leadership to advance the nursing profession means a great deal to our THP nurses and nurses across the nation. We very much appreciate the opportunity offered to Trillium Health Partners to be involved in the development of the toolkit. Two of our nurses who are here with us today, Shelley Petruskevich and Cheryl Deluct, were part of the engagements that took place in the development of the toolkit and brought feedback that I've now heard in the form of 20 pages in a duotang to Leigh from our nurses to feed into the process. We all know that nurses are highly skilled, knowledgeable, and compassionate caregivers who advocate for patients and educate and empower them with knowledge to manage their health effectively. Yet, despite nurses' essential contributions, they face significant challenges in their profession. Long hours and heavy workloads, to name a few, lead to burnout and dissatisfaction and contribute to nurses leaving the profession. This is why it is so important that nurses feel valued, supported, and empowered to thrive from the bedside to the boardroom. By investing in nursing retention, we create a healthier, sustainable, and more fulfilling work environment for nurses, which ultimately improves care for patients. As an organization that is focused on driving quality, the health and wellness of our nurses is a key focus, and we know that happy and healthy people who find joy in their work environment are an imperative to positive patient outcomes. You have to care for the people who care for the patients. At THP, we have leveraged the executive summary of the toolkit to engage with our Nursing Advisory Council to understand the elements that are most important to our nurses and where we need to focus our energy to advance the opportunities for improvement in retaining our experienced, mid-career, and novice nurses. The tools in this toolkit will now help us to advance these priorities using the best evidence, building upon proven strategies tested across the country, rather than having to reinvent the wheel. I am so excited to work with our teams to build upon the work that we already do to support retention, to unlock the full potential of our incredible nursing staff, and make sure that THP remains an employer of choice for our current staff and future staff. I would like to extend heartfelt gratitude to our partners at Health Canada for your continued support and for empowering nurses so that they can continue to make a difference in the lives of our patients and community. Thank you so much for joining us today to recognize the impact of this very important work.
So I have about 30 other speakers. No, I don't. Well, I just want to take this opportunity to thank all of you, to thank Leigh, to thank Terri, to thank Minister Holland, Ruby Sahota, Sonia Sidhu, but most importantly, the phenomenal women and men that make Trillium Health Partners a success, to all of the nurses that take care of us all day, every day, and really don't even complain about it. I think this is going to be a great announcement. It is going to be a wonderful way for us to make sure that not only are we providing the proper services that our communities need, but also to ensure that we are taking care of ourselves as well. So thank you all very much. Now I'm going to pass it on to what might be a fun part, and that is to our moderator for any media questions. Please come on up. Thank you, everyone.
Thank you. Thank you, merci. We'll proceed to questions from journalists here in the room. Please state your name, media outlet, and whom your question is directed to. You will have the opportunity to ask one question and one follow-up. Nous allons maintenant passer aux questions des journalistes présents dans la salle. Veuillez indiquer votre nom, votre média et le destinataire de votre question. Vous aurez la possibilité de poser une question avec un suivi. Let's proceed to the first question. Nous allons passer à la première question.
Thank you. My name is Dorsa Raffar. I'm with Omni News. Minister Holland, we've seen some provinces have already announced measures to help internationally trained nurses and trained doctors see their credentials recognized to work in Canada. Do you think there is a room for a national plan to streamline that process?
Yeah, thank you for the question. So I think, the conversations we had going back to Charlottetown last year with all health ministers present was how do we do exactly that? How do we bring everybody on the same page and try to streamline things nationally? And you know, I look at the Nova Scotia College of Nursing, which has done an incredible job to kind of remove and interrogate legacy practices of doing things and streamline it. We've certainly, on recognition of credentials, set a standard asking all provinces to meet, and that was agreed to in Charlottetown. But for me, the next step as well is looking at having those standards, and I'm talking to Minister Miller around immigration to bring folks in. But I think one of the things that's really important as we're talking about recognition of credentials, bringing people in from other places, students, and this is what makes this announcement so important today, is the work that Leigh is spearheading on retention is everything. Because we can do all of these things to bring new people in, but if this isn't a profession that people are loving and joyful in, if we're not doing the work to make sure that people are staying, you can't fill a bucket that's got a hole in it. You know, you got to make sure that we're keeping those retention rates exceptionally high. So it's a myriad of things that you've got to do to come at this, as well as future workforce planning.
Thank you. My follow-up would be, how do you think that this new retention toolkit will allow new nurses and doctors who are trying to get their credentials, how will it help them in this process?
Well, I think at a high level, it's by making sure that people aren't reinventing the wheel, that what has worked, what is proven, what is going to be effective, can be implemented everywhere around the country instantaneously. I think knowledge translation is going to be so critical. One of the pieces we're working on, and we've talked forever, is data. We think about that in patient records or in sharing data between institutions, but sharing knowledge and sharing best practices and determining what is working in one part of the country, chances are it's something that should be considered elsewhere. And so the work that Leigh has done to take all of that information, all of those best practices, put it in an explicit toolkit that folks can deploy for the purposes of retention, I think is extraordinary.
Good morning, Ministers. Tom Sefnak, CP24/CTV News. A couple questions for you. The first one is measles. We know there's been a little bit of resistance from people, particularly against vaccines. We've seen the spread in various communities throughout the country. What's the federal government's plan to deal with that, or to implement vaccinations, follow-up vaccinations, and to deal with the potential wave that's coming over from Europe? So that'll be the first question for you, Minister.
Well, I'm deeply concerned with the outbreak that we're seeing of measles, and frankly, we're seeing a lot of illness that was almost rendered non-existent starting to come back because of vaccine hesitancy. We have to depoliticize health information. We have to be a society that follows a science and evaluation. And so that's a role, you know, for what I think for Iqra, Ruby, and Sonia that we think about every day. How do we take us out of health information? You know, there should be no partisanship in following the best health advice that's rooted in science and evidence. And we can see, because there was a debate around vaccines, and this was frustrating, and I know it was for a lot of healthcare workers, talking to folks and say, well, you know, I don't see measles, mumps, rubella, I don't see these things, so, you know, we don't really need a vaccine. Not understanding the reason we don't have them is because we have a vaccine. The vaccines that happened during the pandemic, but whether or not they're mRNA or not, are a miracle of science. They saved tens of millions of lives. And so the fact that that's been politicized is deeply concerning, and we're seeing the effect of that. So first and foremost, I want to take myself out of that conversation and just really refer people to their health professional, to their health teams, to their doctor, to the nurses to talk about making an informed choice for their health, and just ask folks to keep their vaccines up to date, because the consequence of not doing that can be potentially disastrous to the health of them as an individual and to communities as a whole.
Second question for you. Are there any, have you had any discussions with the provincial health minister and the Ontario pharmacare plan? Any indication as to where that's going and how it's progressing? I know that there have been some conversations, so we're just looking for some further information on that.
Yeah, I've been very fortunate. I've been able to talk with all of my provincial and territorial counterparts, you know, and there'll be a lot more conversations to have. But initially, all of those conversations have been very positive. You know, I think when it comes down to it, and folks in this room will know it, imagine for somebody who's in an income insecure situation who has to face a choice, do I reuse this syringe or do I pay for some new syringes and maybe not have the money that I need for another essential element of my life? Do I have my diabetes medication or do I get food for my family? Those are not choices folks should be making in this country. And the problem is when you reuse a needle, there's huge health concerns about what that will mean. When you don't take your diabetes medication, that can lead to an amputation, that can lead to a stroke, that can lead to a cardiac event. So, you know, it costs us a huge amount of money to not have this be present. So those are the kind of patient-centric, outcome-centric conversations that I'm having with provinces. Because I don't think people care about the partisanship of it or care about the jurisdiction. I think we just all agree that people should get the medicine they need to keep them healthy.
Just specifically for Ontario, are you close to reaching an agreement?
Well, I mean, so first of all, we got to pass it through the House of Commons, and I think that's going to be an easier path. I know that the NDP has indicated that they're supporting it. Obviously, I've worked with Don Davies. We'll have to see what the other parties do. But I'm having conversations now. I'll be in Iqaluit later today. I'll be meeting with Minister Dix in British Columbia later in the week. Throughout the next 2 weeks, I'll be all across the country meeting directly with my counterparts. I want to get this done, basically try to negotiate these agreements even as we're working through it in Parliament. Sylvia Jones and I have both spoken and exchanged messages recently over the last few days. And I think, you know, I don't want to speak for her, but I want to say that, you know, she's been very reasonable in these conversations, and I'm extremely optimistic that we can, in short order, find an agreement.
Okay, thank you, merci. We'll pass now to the Zoom for any further questions. Nous allons passer à Zoom maintenant pour toute autre question.
Merci beaucoup. Si vous êtes un journaliste et vous désirez poser une question, veuillez utiliser l'option de lever la main. Merci de vous limiter à une question et un suivi. Veuillez aussi modifier votre nom dans le Zoom pour indiquer votre nom et votre média. If you are a reporter and wish to ask a question, please use the hand-raising function. We ask that you limit yourself to one question and one follow-up. We also ask that you modify your Zoom handle to reflect your name and your media outlet. We will now start with a question from the Canadian Press.
Oui, bonjour, M. Holland. C'est Michel Sabat de la presse canadienne. Sur l'assurance médicaments, croyez-vous que d'imposer des conditions est une bonne approche dans les relations provinciales fédérales?
Pour moi, il y a l'utilisation d'expression condition, le mot condition. Pour moi, ce n'est pas l'enjeu. Pour les personnes partout au pays, et c'est certainement le cas pour les Québécois et les Québécoises, c'est vraiment une question de leur santé, de s'assurer que quelqu'un qui a besoin de médicament peut recevoir le médicament que les personnes ont besoin. Et alors, ça, c'est la raison pour laquelle, quand je parle avec le ministre Dubé au Québec, par exemple, j'ai beaucoup d'optimisme que c'est possible de trouver une entente parce que c'est vraiment une question d'une augmentation d'accessibilité pour le médicament. Ce n'est pas pour moi une question de jurisdiction. On peut trouver avec ça. Et je pense que les personnes ne veulent pas le chicane, les personnes veulent les résultats.
D'accord, mais vous ne répondez pas spécifiquement à ma question. Donc, si je reste sur cette idée de l'approche, quelles sont vos craintes? Que craignez-vous de dire aux provinces, nous avons une offre alléchante, nous allons vous convaincre, mais si vous n'en voulez pas, vous pourrez vous en retirer sans condition ou autre terme que vous voulez employer et avec pleine compensation?
Alors, c'est évident que chaque système de santé, ça fonctionne différemment dans chaque province et chaque territoire, et ont besoin de flexibilité de travailler avec chaque province et territoire. Et je suis à l'aise avec ça, je n'ai pas de problème avec ça, mais ça, c'est la raison pour laquelle j'évite le mot « condition » parce que ce n'est pas vraiment l'aider. Quand j'ai parlé avec le ministre Dubé, par exemple, on a une conversation vraiment sur les résultats. Qu'est-ce que c'est la façon d'obtenir le résultat que chaque personne avec le diabète peut obtenir le médicament gratuitement, universellement, et ça, c'est le vrai enjeu, à mon avis.
Merci, ministre. On a maintenant une question d'Olivier de TVA.
Oui, bonjour, Monsieur Holland. Vous l'avez abordé un peu plus tôt, la question de la rougeole. Il y a un point de presse de la santé publique du Québec qui doit avoir lieu autour de 13 heures. Je me demandais simplement si c'était une situation qui vous inquiétait personnellement au niveau fédéral.
Pardon, c'est pas clair votre question. C'est du nouveau enjeu là? C'était pas clair pour moi, pardon.
Est-ce que vous m'entendez bien, Monsieur Holland?
Oui, c'est plus clair maintenant, oui.
OK, c'est au niveau de la rougeole measles. J'en avais parlé un peu plus tôt dans la conférence de presse. La situation, est-ce qu'elle vous inquiète que la santé publique doit faire le point autour de 13 heures sur ce qui se passe au Québec présentement là-dessus? Là?
Oui, ça m'inquiète beaucoup. La situation avec le measles, c'est pas acceptable et c'est vraiment une maladie qu'on peut éviter totalement. Et alors, ça, c'est la raison pour laquelle c'est absolument essentiel que les personnes prennent le vaccin pour ça. Et on a besoin d'une conversation dans le domaine de santé qui reste sur le fait seulement et la science. Et c'est le danger avec le mauvaise information. Il y a une grande conséquence pour ça au Québec, mais partout au monde.
Merci, j'ai pas de suivi, M. Holland. Merci beaucoup.
Merci beaucoup.
Parfait. Alors, dernier appel pour des questions sur le Zoom. Last call for questions on the Zoom. Parfait. Alors, on va retourner à la salle. Oh, désolé, il y a d'autres questions. On a Cormac McSweeney. Vous y allez.
Hello, Minister. I'm just wondering, when it comes to pharmacare, if you could tell me, do you believe that you might be able to strike some deals with provinces so that by the end of this year, we could see pharmacare in place in some provinces?
Absolutely. I have to say I had a conversation with Premier Fury just a few days ago from Newfoundland and Labrador. He's exceptionally excited on behalf of his province to get rolling on this as fast as possible. Obviously, a lot of details to discuss. But I had also a conversation with Adrian Dix, who I'll be seeing in just a couple of days in Vancouver. Minister Dix, with their government in British Columbia, wants to sign something even before the legislation is passed. So I appreciate their enthusiasm. I also want to recognize BC's leadership when it comes to universal contraception, which I think is absolutely critical. Look, this is fundamentally about women having autonomy over their own bodies. Over their reproductive lives to have access to the contraception that they need. And it's essential for those with diabetes. So we want to see these get signed as quickly as possible. I've had many good conversations, a lot of work to be done, obviously, but I'm very optimistic we could see people receiving these medications before the end of the year.
And just as a follow-up, there's a new poll that is done by Ipsos for Global that shows 42% of Canadians would consider going across the border to the U.S. to pay for health care, given the long wait times and staffing challenges that we've seen in this system. That's up 10 points since last year. What does this tell you about the state of our healthcare system, and how specifically are you going to address this?
Well, let's first say unequivocally that private care is not the answer. That going and paying your way out of your circumstance creates a terrible malady in our system. Because what it means is that private carriers will take the cases that are the most profitable and for folks who have money, leaving the public system eviscerated. And that is a circumstance we cannot allow. And I would say that, health systems that have operated on this model are an abject disaster. The answer is in the work that we're doing, is in making sure that we rise to the challenge to transform our health system. And that's exactly what's happening. These bilateral agreements took a lot of time. There's a lot to negotiate. But as we release them and you see the plans, you can see the difference they're going to make. So I would say to folks, most of the waiting that is occurring is for either elective procedures or for procedures that are not in an emergency circumstance, that people be patient with those. I know that's hard, but that we are working on making sure we get through these health workforce issues. That's one of the big outcomes of the announcement and the work that Leigh has been doing, and the investments that we're making directly with provinces and territories. I'm looking forward to convening health ministers again very soon to continue to talk about how we work through these issues and continue to improve things. But you're seeing material improvements. You know, where we were 18 months ago is not where we are today. And I think that's what people want to see. They want to see that line of progress. There's a report out very recently citing that Canada's the second best healthcare system in the world. You know, we want to be the first, and we want to be there by a long mile. But that's going to take incremental progress, and we have to show that progress every day. Have to show it in data. We have to show it in improved health outcomes. But we cannot have people begin spending money in private systems or private models. That'll be the end of quality care for all of us.
So again, dernier appel pour des questions sur le Zoom. Last call for questions on the Zoom. Okay, perfect. That concludes our Zoom questions. I will return it back to the room. Thank you.
Okay, that concludes today's event. Thank you. Ceci conclut l'événement aujourd'hui. Merci.
And in April.